Hi, let's do red blood cell maturation. So red blood cells, they come from myeloid stem cells. That just means bone marrow stem cells. And then they progress through these different stages, proerythroblast, erythroblast. Blast just means a brand new cell. Reticulocyte is the word I want you to remember because that is the stage right before they become mature red blood cells. So red bone marrow produces a proerythroblast that is basically a stem cell for a red blood cell, and it develops through different stages. But I want you to remember the reticulocyte is the step right before it becomes a mature red blood cell. That's really important for you to remember. And how many days does a red blood cell survive before it's recycled? About 120 days. Erythropoiesis just means creation or building of red blood cells. It requires vitamins, especially vitamin B12. B12 is absorbed in the intestines and requires the use of intrinsic factor. We'll cover that later. If I lack intrinsic factor and I don't get vitamin B12 into the body and I can't make red blood cells, I end up with something called pernicious anemia. Anemia, the word an is without, emia is blood, so it's a condition where you have a low number of red blood cells. EPO is the hormone that helps to stimulate the production of red blood cells. And this is a list. Hematocrit, I believe we did cover that when we talked about hematocrit, the difference between men and women. We said that men have a higher hematocrit count because they have more testosterone, more steroids in their blood, and that produces more red blood cells. Women have less because they don't have as much testosterone. They still have testosterone circulating, but not as much as men. The reticulocyte is what again? We said that's the stage before it becomes mature red blood cells. So how can you tell the difference between, let's say, someone that has, let's say, blood doping versus using EPO to help you out in a sporting event? So let's say that I have a set number of red blood cells, right? And I know what the count is for a red blood cell. But I find that in one patient I'm doing a lab exam for, they have more reticulocytes. What did I say reticulocytes were? Well, they're basically immature red blood cells. So that means this person might have used EPO, which is a hormone or even a drug that can stimulate the production of red blood cells. That would increase the ratio between new red blood cells and older red blood cells that are circulating for 120 days before they're recycled. But let's compare someone that's blood doping. What is blood doping? Blood doping is when someone siphons or pulls out some of their blood and then they store it maybe in the refrigerator, however they're going to store it, and then they put it back into their circulation before an event so that they have increased red blood cells, increased oxygenation to tissues, and therefore they're cheating. What would they have an increase in? They'd have more old red blood cells. So the ratios would be off between someone that's using EPO and someone that is blood doping. Just interesting facts. I won't be testing on this. So again, red blood cell count just tells me how many red blood cells I have. Hematocrit is a percentage of red blood cells to the whole blood that you have circulating. And let's stop there and we'll continue in a little bit.